warahmatullahi wabarakatuh. Sawubona, Dumilan, Namaste, Vanikam, good afternoon, and Goeiemiddag. Welcome to this important webinar that we are hosting. We want to welcome all of you, listeners and viewers, parents, learners, and listeners of Radio Channel Islam International. We hope that we will have this session as interactive as possible, and we will announce to you when the chat room will be open for you to send your messages. My name is Muhammad Amra. I'm the host, and I am the director of Wonderkids Montessori Preschool and Primary School. So we have a special welcome to our parents and our learners. We have support of a number of people, and we have a very exciting range of panelists, all professionals in their fields, to make a presentation. The objective of this session is to discuss some of the parents' concerns and fears they have in sending the children back to school. So we're hoping with the specialists that we have on the panel that they will discuss some of these issues and allay your fears as to whether you should or you should not attend go back to school. So the title of this session, of this webinar, is "Should you send your children back to school?" The program is going to be in this format. Dr. Ahmed Manjra, who I'm introducing to you, is a specialist pediatrician and a specialist in allergies or allergist. Followed from him will be Dr. Farheen A Majid, who is a clinical psychologist, for 7 minutes. Thereafter followed by Dr. Aamena Moola, who specializes in holistic and integrated medicine. And then we have Nasreen, Sardiwalla, also a clinical psychologist. The beauty of this panelist is that 3 of the ladies are mothers, and Farheen, who had her child already in our preschool, Wonderkids preschool, and currently both Aamena Moola and Nasreen Sardiwalla are parents of the school. So they have 2 hats, they're wearing 2 hats. One is a parent and of course in their profession. So without much ado, I want to hand you over to Dr. Ahmed Manjra, who will be making a PowerPoint presentation, just to inform all our listeners and viewers that this session will be on YouTube, later on Facebook, and you can have access to it and broadcast it to as many people as possible if you feel benefit. So Ahmed, it's to you to start your presentation.
Bismillahirrahmanirrahim. In the name of Allah, the Beneficent, the Merciful. Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor and a pleasure to speak to you today about something that I'm very passionate about, and that's whether should children return to school. So just to first give you a background, that the COVID-19, which is the designated name for the coronavirus, which started in November 2019 in the province of Wuhan in China. And in just a matter of a few months, this has become a global pandemic. It's a viral infection. It's caused by the coronavirus, which was passed on to humans from bats by zoonotic transmission. The mechanism is quite complex, and I don't want to really go into it. But basically what happens is that when humans come into close contact with animals, either by direct contact, indirect contact, these viruses then mutate, and they basically cross the species, and they pass on from one animal species to another animal species. At this point in time, and of course, coronavirus is not a new virus. We've had other coronavirus epidemics, which is the SARS virus as well as the MERS virus. The MERS virus was transmitted from camels onto humans, and the COVID has been thought to be from bats onto humans. At this point in time, it's almost more than 4 million people infected. The death toll globally is around 400,000. This is unprecedented in recent times over such a short period of time. In South Africa alone, we have almost 40,000 infections and 900 deaths. And of course, the mortality and the infection rate is rising. Now, these kind of pandemics occur every 100 years. And epidemiologists, who are people that study the transmission of diseases and pandemics and so on, very long time predicted that around 2019, 2020, we are going to be faced with a catastrophic infection. They didn't exactly know which it was or what it was going to be, but they've been absolutely correct in their predictions. And of course, the last one was the Spanish flu, which occurred in 1918. It lasted many years, and hundreds of millions of people were infected, and the mortality was very high. At this point in time, almost every country globally has been affected by this pandemic, and South Africa is no exception. I'm trying to change my slide, but it's not happening. Okay, so how is this transmitted? So there is a big difference between a droplet infection and an airborne infection. So airborne infections are like chickenpox and measles and many others. Droplet infections occur by getting yourself infected with droplets of mucus or sputum from another person. It's by direct contact. It occurs through contact with people who are infected. So if a person coughs, sneezes, touches, or is in contact with surfaces, they will infect the surfaces. And we know the virus can remain active on these surfaces for at least 72 hours. And if another person comes into contact with an infected surface, they will become infected. To some extent, there's no like black and white and clear distinction between droplet infection and airborne infection, because droplet infections or droplets can also be airborne for short periods of time, especially when a person is coughing or sneezing, and it can remain airborne for many hours, and that can make people susceptible to infections as well. It's mainly transmitted through the mouth, through the nose, as well as the eyes. And airborne infections are transmitted very differently. So airborne infection, for an example, chickenpox, you don't have to be even in the same room or in direct contact with somebody who has chickenpox. You can be in a separate room and you can pick up chickenpox infection. One of the common ways of picking up COVID-19 is touching of the face with hands. And this is why we always ask people to sanitize their hands, to wash their hands, and to avoid touching their face. It's been shown that COVID-19 can occur in outbreaks in crowded areas like schools, places of worship, shopping malls, as well as hospitals. And what differentiates COVID-19 from other infections, such as influenza, is that even asymptomatic people can transmit the virus. So you may carry the virus, you may have absolutely no symptoms, but you can transmit the virus to another person without even you knowing that you've got the virus. And that's what makes it more dangerous and more different from influenza virus. So influenza, rhinoviruses, which are common cold viruses, and flu viruses, you're only infectious when you have symptoms such as coughing, fever, runny nose, or sore throat, but not so with COVID. You can pass on the infection even when you have no symptoms, but you are a carrier of the virus. Now, the good thing is that the majority of people that are infected with COVID-19 will experience very mild symptoms, and more than 80% of people will have very mild symptoms. 15% of people will get very ill and will require hospitalization, and 5% of people will require ICU care. The mortality rate is about 2 to 3% for COVID, and the mortality rate for influenza is less than 1%. Now, those that die from COVID mainly have lung-related complications, but can have other complications as well. So let us look now at risk populations, and this is what we've learned. So you must remember that this virus has only been around for the last 6 to 7 months. And what we have learned about this virus, how it spreads, the epidemiology, the behavior, the biology of this virus, has been from studies in China, in Italy, in Spain, in Western countries, as well as the United States. So what we found is that A person between 60 and 90 and 69 years of age is 27 times more likely to die from COVID-19 infection than compared to a person who is less than 40 years of age. A person who is aged 70 to 79 years of age is 50 times more likely to die compared to a person who's less than 40 years of age and also infected. And a person who is more than 80 years of age is 70 times more likely to die compared to a person who is infected at less than 40 years of age. What they have found is that usually people that have comorbidities, and comorbidities simply means people with underlying medical conditions. And you've got a higher risk of dying, 45% chance of dying if you've got heart disease, 20% if you've got hypertension and diabetes. So the risk populations really for mortality, which means those that are at risk of dying from COVID-19 complications, are those more than 60 years of age and who have underlying medical conditions such as heart disease, diabetes, and hypertension. What we've also found in this pandemic is that obesity is a significant risk factor for death. And if you are obese, which means your BMI is more than 30, you've got a 20% more likely chance of dying than a non-obese person. So I think this pandemic is an important opportunity for some of us who have weight problems to try and start exercising and controlling our diets to reduce our weight, because it's a significant risk factor for mortality when you're infected with COVID. So what symptoms do people have with COVID? The most common is fever, cough, sore throat, and tiredness. And as I've said, the majority of people, 80% of people, will recover completely from this as they would from the normal cold or normal flu. Less common and more ominous symptoms are aches and pains, sore throat, diarrhea, loss of smell and taste. And this has been, there's a lot of that have been written about this, nausea and vomiting and weakness. More serious symptoms are difficulty in breathing, and this is usually a sign of an underlying lung infection, or we call it pneumonia, shortness of breath, chest pain, loss of speech or movement. And when a person has these symptoms from COVID-19, that patient is in serious trouble and will probably require hospitalization and intensive care. Now, most of the initial information that was derived from the studies in Wuhan, and this was published in medical journals, was that children played a very big role in viral transmission. And they were the vectors of the virus. And they were the super spreaders of the virus. And that children had symptoms, but they were mild. And because the symptoms are mild and the symptoms are not, taken seriously, many of them mingled with the local population and infected the general population. But China is not the world. China has a very strict one-child policy, and many of the epidemiological data that applied to China did not apply to the rest of the world, such as Europe and North America and Africa. And since the Wuhan epidemic, we started in November, the story has evolved quite significantly. So what we know now is that COVID-19 is not just another respiratory viral infection. The mortality is higher, the morbidity is higher, the complication rate is higher, and even asymptomatic people, that means people that just carry the virus, can spread the virus quite prolifically. There's a large discrepancy in case rate and prognosis between young children and older adults that has caught all of us by surprise. And it seems as though this virus has spared children and has particularly infected the older population and has particularly caused mortality in people with significant underlying medical problems. The mechanism for this is unknown. There's been a lot of postulation why children are not infected and why children are not experiencing the complications that adults are experiencing. And the mechanisms have ranged from the BCG vaccination, other childhood vaccinations, the frequency of viral infections that children have, and therefore the buildup of the immune system, and many, many other theories, but we have nothing at this point in time to clearly make us understand the mechanisms as to why children have less infections than adults. So just to show you here, this is the RO, or it's called a basic reproductive number. And for seasonal flu, one person with seasonal flu, and the red is the one person that has the infection, can spread it to 1 or 2 people. And the number of people that it spreads it to is shown in green in this slide. For COVID-19, one person who is infected with COVID-19 can spread it to between 2 and 3 people. With the normal SARS virus, one person can spread it to 3 to 5 people. And measles, which is really a deadly disease, one person can spread it to 12 to 18 people. And I just want to make a point here. Measles spreads faster, it's airborne and droplet, and it is much more infectious than COVID-19. And the complication rate in measles are significantly higher than COVID-19, seasonal flu, as well as SARS. More people die from complications of measles than any other virus. And it is only because of vaccinations that we're not seeing the chaos that we're seeing in this world. If people were not vaccinated against the measles virus or measles disease, we would have seen much more chaos in the world than we're seeing now with COVID-19. And it is through vaccination of children at 9 months of age and 15 months of age with the MMR vaccine or the measles vaccine that has actually led to a significant decline in the infection rate as well as the mortality from measles. What's interesting is that during the Ebola outbreak in Congo, when the focus was on Ebola, people were scared to take their children to the clinics for vaccines. And many of these children did not have the measles vaccine. And what we're seeing now as we speak is a massive measles outbreak in Central Africa, which has led to thousands of deaths in children because of measles and because the children were not vaccinated during the Ebola outbreak, because the focus was on Ebola and people forgot about other diseases as well. My point here is that even though we're going through a pandemic of COVID at the moment, do not forget about the other diseases or childhood diseases that exist, and do not neglect to vaccinate your children against the other diseases as well. So what we do know is that children are less likely to acquire SARS-CoV-2, which is the COVID-19, than adults. And if you look at the percentage of children that are infected, it's only 1 to 3% of reported cases across the country. And children and young people have a much lower susceptibility to SARS-CoV-2 than the adult population. So just to show you on this diagram here, that you can see that this shows you the age group and the number of infections. So on this axis is the number of infections or number of cases, and this axis shows you the age group. So the vast majority of infections occur, and the dark blue is females and the light green is males. And you can see the vast number of infections occur in this age group, which is between 20 and 65 years of age. But you can see the infection rate in children under 19 years of age is extremely low. So in countries with widespread community testing, children were found to have very low infection rates. Both in Korea and Iceland, there were no children infected less than 10 years of age. That means, and in these two countries, there was extensive testing done. They had a lot of manpower and the resources to do widespread testing. And they found that under 10 years of age, no children were infected. Then they also found that in a town called Vo in Italy, where 86% of the population were tested, 2.6% of the general population was infected, but no children under the age of 10 were infected. This despite the fact that the children were living with the adults. How do you explain this phenomenon? We don't know. Allah knows best. Data from Japan and Guangzhou province in China have also demonstrated a much lower infection rate for children than their adult counterparts. And evidence is therefore emerging that children could be significantly less likely to become infected than the adult population. So we know now from the studies, these two studies that I've shown, or many other studies as well that have come out now and published in medical journals, that the infection rate in children is very, very low. Now, do children really get sick when they get infected with with COVID-19? So most children, the vast majority of the children, and I would say about 99% of children, would have a transient upper respiratory tract infection, no different from the common flu, no different from the common than from the common flu, which is a rhinoviral infection. And one of the reasons for that is that they have minimal viral shedding, or less likely scenario of showing minimal symptoms despite significant viral shedding. They usually have symptoms of the common cold, and even those with mild underlying medical conditions don't have complications. Those with underlying medical complications may have more severe symptoms and complications. Now, to date, almost 400,000 people have died from COVID-19 globally, but less than 100 children have died from this infection. And that is also an exaggeration. It's probably even less than that. And every single child that have died from this infection with COVID had serious underlying medical problems. So it seems as though the vast majority of children do not have significant complications from COVID-19. So very few children, less than 100, have died from COVID complications. So what symptoms do children have? Most of them will have a fever, they'll have a cough, they'll have a runny nose, they'll have a sore throat, and most of these symptoms will be mild and won't be significant. So children have less severe disease, accounting for less than 1% of severe cases and deaths. And children also are more likely to be asymptomatic than adults. So children who carry the virus, who are carriers of the virus, are more likely to have no symptoms compared to the adults. Now, a lot has been made in the medical media and the press about a particular complication, which is called pediatric Kawasaki-like multi-system inflammatory syndrome. Now, it is extremely rare for this kind of syndrome to occur. There have been a few reported cases in the US as well as Europe. The exact mechanism for this is not known. Many of these patients that had this disease, which is pediatric Kawasaki-like multi-system inflammatory syndrome, were also COVID negative. The vast majority were COVID positive. And we're not sure if there is a causal link between COVID-19 and this particular complication. Some children can get pneumonia, and some may get vomiting and diarrhea, which can cause dehydration and may require hospitalization. So we know that very few children will get infected, very few children will have significant complications, and those that will get complications are usually those that have severe underlying medical problems. Now the big question is, do children spread the virus? And do we have good evidence that children are super spreaders of the virus, as we thought and originally learned from the Wuhan experience? So what was interesting is that a case study of a cluster in the French Alps included a child with COVID-19 who failed to transmit it to any other person despite exposure to more than 100 children in different schools and a ski resort. And also in New South Wales, none of the 735 children and 128 staff contracted COVID-19 from 9 children and 9 adults despite close contact. Now, earlier on, I showed you the rho factor, the RO factor, which is the transmittability of the infection. In the Australian study, so if it's 1, that means you can spread it to 1 person. If it's 2, you can spread it to 2 people. In the Australian study, they found the RO factor was less than 0.1. That means there is like a less chance than even 1 person. So the transmittability from children to adults and from children to children is extremely low of the COVID-19 infection. Also in the Netherlands, the separate data from primary care and household studies suggest that SARS-CoV-2 is mainly spread between adults and from adult family members to children, and not the other way around. Now, one of the mechanisms of transmission, of course, is viral load. So we know that it is by direct contact, it's by droplet infection. And what this German study showed is they looked at viral load at different age groups. And this shows the degree of viral load on this side of the graph. And this side of the graph shows the age group. And you can see from 0 to 6 years of age, 7 to 10 years of age, and so on. And you can see in children less than 6 years of age, the viral load is very small. And in children 7 to 10 years, it's even smaller. And it gets bigger and bigger and bigger. And those who are mature, more than 45 years of age, the viral load is much higher. The point is that the higher the viral load, the higher the chance of transmittability of the infection. The lower the viral load, the lesser the chance of the transmittability of the infection. And what this graph shows is that because children have a lesser viral load, a lower viral load, the chances of them transmitting the infection is significantly low than their adult counterparts. Now, are teachers at risk of picking up infection from children? Again, studies have shown that they're not at risk of being infected by children. They are at higher risk of contracting the virus from other adults, from colleagues, at home, or in a community outside school. And the risk of teachers picking up infection from children is also very small. A word of caution here is that teachers with comorbidities are at increased risk of severe COVID-19 complications. And therefore, if they're more than 60 years of age with any underlying medical problems such as diabetes, hypertension, heart disease, or any immunocompromising disease, they need to take care or may have to suspend their teaching profession for a short while until this pandemic subsides. Now, many schools in many parts of the world have already opened. And one of the amazing things of this pandemic is how information has spread from different countries as the pandemic was evolving. And at this point, we have no data on the relative contribution of school closures to transmission control. So whether closing schools made any difference to transmission of the virus, we don't know. The COVID-19 modeling studies predict that school closures alone would prevent only 2 to 4% of deaths, much less than other social distancing interventions. COVID-19 incidence in South Africa will inevitably increase over the next 3 months and possibly go on for longer. And we know that we are only going to peak around July, August, September. And you obviously can't keep schools closed for that period of time. Postponement of re-entry to school to reduce transmission risk to negligible would entail a delay of many months before schools could open. School opening in many high-resource countries have not resulted in any major COVID-19 outbreaks. So our view at this point in time is that schools must open. There would be outbreaks in schools every now and then, and those particular schools may need to be closed. But there is no need to close all schools on a global basis. So there have been sporadic cases reported. Example, about 70 children in France in the first week of reopening, but that's amongst 1.4 million children who returned to school. So that's the only study where there were sporadic cases reported. But again, you can see the numbers are very low. 70 infected children amongst a population of children of 1.4 million. How do we reduce infections in school? Well, certainly one of the ways is to reduce learner mixing, closing the playgrounds, canceling non-essential activities, keeping learners in fixed class groups or classrooms, staggering school start times and breaks across the classes, shortening the school weeks or days, reducing class sizes, extra hand washing, and extensive use of sanitizers. One of the problems that we will have in South Africa is that in winter, and we're already into winter, many of the winter viruses will start appearing, such as influenza, respiratory viruses, respiratory syncytial virus, which causes bronchiolitis, and rotavirus. And in the presence of COVID, this will complicate the issue, because when you see a child with a runny nose, cough, and fever, we would not know whether it's COVID or the common cold virus or the influenza virus. It will be very difficult to distinguish between COVID from other viral infections. And the only way would be probably to do extensive testing to see which virus the child is infected with. Of course, at the end of the day, it will probably make very little difference, because all viral infections do not require antibiotics. Antibiotics don't kill viruses. Antibiotics kill bacteria. And most of these children will require symptomatic treatment, fever control, and hydration, and that's about it. There is no effective treatment against viral infections because most viral infections are self-limiting. Now, are children with underlying medical disorders at risk of complications? Again, there is very little evidence so far on the effects of COVID-19 on children with comorbidities, very different from the adult population. So it's almost like you're dealing with different viruses, a virus that infects children that hardly causes complications, and a virus that infects adults with comorbidities and causes significant complications. In Wuhan, there were 3 children who needed ventilation, but all 3 of them had severe underlying medical conditions. So who can go to school with chronic illnesses? So I've had requests from, because I'm an allergologist, I see, thousands of asthmatics, from mothers of children who don't want to send their kids to school because they've got asthma. There is absolutely no reason for asthmatic children not to go to school. The only exception is if you've got severe uncontrolled asthma on treatment. So if you're on treatment, you've got well-controlled asthma, it is safe for you to go to school. And this is the view of all the allergy societies from throughout the world. But if you've got severe asthma, which results in ICU admissions, if you've got what we call near fatal asthma or brittle asthma, then of course that's a completely different ballgame. Other allergic conditions like allergic rhinitis, eczema, urticaria can safely go to school. Patients who are HIV infected on treatment can safely go to school. People with any immunocompromising illnesses of a mild nature can go to school. But children with severe heart disease cannot go to school. But in every case, you need to get the advice of your pediatrician. So children that can't go to school, those that are severely immunocompromised, cancer chemotherapy, that have malignancies, uncorrected significant congenital heart disease, chronic organ failure, chronic respiratory disease like cystic fibrosis, or any chronic lung disease like severe TB, children with severe neurodevelopmental disability, because many of them have respiratory problems as well, and children with diabetes. Again, in each case, you need to seek the advice of your specialist. Who should not go to school apart from the categories that I've mentioned? Sick learners, teachers, and other staff. If you are symptomatic, you should not go to school. Children who have a fever, cough, runny nose, and sore throat, or diarrhea, or vomiting should stay at home. But that's not only because of COVID, that's from any other viral infection as well. Every school should have symptom screening. Most children will be asymptomatic carriers, so you need to remember that. So your symptom screening will be normal. And of course, nowadays there's a scramble to buy these digital thermometers, which are handheld, and it's been shown that they actually have minimal benefit for routine thermal screening. But unfortunately, because it's a legal requirement for many businesses, schools, and places of worship, we've got to use these thermal scanners. Measures in school, these are some of the measures that can be implemented. I'm seriously running out of time, but schools should provide water, sanitation, waste management facilities, and follow environmental cleaning and decontamination procedures. Those areas that have high traffic should be regularly disinfected. The focus should be on surfaces that are frequently touched, such as railing, lunch tables, sports equipment, door and window handles, toys, teaching and learning aids. Cleaning of the environment should be with soap and water, or wiping with alcohol or chlorine-based solutions. And of course, the transportation of these children, many children use public transport, should be safe as well, and attention should be given to that as well. Physical distancing for individual children, measures such as 1 meter apart, and there's a recent paper in The Lancet which was published this week, which showed that the more distance you have, the average they recommend is 1.5 meters, but 2 meters is even better. This may be very difficult in our crowded classroom situation. So 1 meter apart would suffice. Masking, regular hand washing with soap or sanitizer use if water is unavailable should be implemented. And this is a responsibility of the school governing bodies and the school authorities to make sure that all these measures are in place. Now, an individual child older than 4 years of age should be required to wear cloth face masks to prevent disease transmission, but you cannot enforce this in children less than 4 years of age, since it may be uncomfortable for them to do so. Use of plastic shields and other high safety category masks is unnecessary, although not discouraged, and there is no need for children to routinely put on aprons, gloves, or other protective gear, and that is completely unnecessary. So that's the end of my talk. Children are less affected by COVID. That's my summary. Few children will get infected. Those that are infected will have mild symptoms. Infected children are not prolific transmitters of the virus. It is safe for most children to go to school, and children with serious underlying medical conditions must seek the advice of the pediatricians. And schools must implement measures to reduce chances of infection. And the last comment I want to make is that I've seen a significant number of patients in the last few weeks with lots of psychological problems, which are related to closure of the schools as well as the lockdown. It has a significant effect on children. I've seen children with depression, with anxiety, with sleep disturbances, with eating disorders, as well as conversion disorders, all related to the lockdown and the fact that they can't go to school and there's too much of COVID talk going on at home. So I leave that to the psychologists to discuss the psychological effects of children and how to mitigate that. So a lot of the references and the information that I have got for this talk is from the South African Pediatric Association, as well as a paper that was published in the Archives of Diseases of Childhood on the 5th of May. And also need to caution our listeners, our dear listeners, that remember that knowledge about COVID-19 is still evolving. This pandemic is only 6 months old. And what we know is very little compared to what we don't know. There's still a lot to be learned about this virus, about its transmissibility, about how it affects different population groups, about susceptible populations, about in what type of populations would the vaccine work. Why are people of color, for an example, in the US and minority groups are more at high risk of mortality than the general population? So all these are unanswered questions, and hopefully with the rapid evolution of science and technology and knowledge, some of these questions will be answered. So I thank you for your time and your patience, and I hand you over to the convener.
Thank you very much, Ahmed, for that very comprehensive, summarized version of the whole impact of COVID-19 on the society and in particular our children, because I think many parents are still apprehensive about sending their children. They have the fear, and I think you've really, with your experience as a pediatrician, I think has made a very good presentation. I think it's appropriate now to come in with Dr. Farheen Majid, who is a clinical psychologist, and I think I leave it to her, giving about 7 minutes only to discuss the psychological, emotional issues affecting young children. So over to you, Farheen.
Jazakallah, Mohammed. And thank you to Dr. Manjra for a very informative presentation. I think not only was it informative, but quite reassuring to listeners, parents, educators, and children as well. The COVID-19 and lockdown context is a very tenuous and uncertain one. And the big question being, should children go back to school, is one that is, I think, on many parents' minds. Many teachers have been asked these questions by parents, but it would be reckless for any of us, even as professionals, to claim the rights to a definitive response to this. The reality is that nobody has all the answers. The reality is that this is a bridge that is being built while we are all still walking on it. So we are learning essentially as we are going along. And the same will apply in terms of the return of children to school. Principals, heads of departments, teachers, parents, and children are going to be required to accept that there are no clear-cut answers. There is no formula to refer to, and that the formula is being developed as this new experience unfolds. Therefore, we've got to make friends with uncertainty. We have to accept that uncertainty is part of this process. Much of the anxiety about children returning to school, I think, relates to the fear of COVID transmission. But I suppose after listening to Dr. Manjra's very informative presentation, there has to be some reassurance gauged from that, particularly that children are lowest at risk in terms of susceptibility to transmission. And more so as well, looking at particularly the private sector of schools, there has been a lot of transparency related to the implementation of safety protocols that are currently being put in place at schools. Lots of rigorous safety measures have been put in place, and parents have been privy to this through social media and through visual channels, so that they have easy accessibility to view firsthand how the layout has been designed. However, the psychological and emotional safety of children also needs to be incorporated into the framework of safety protocols. And this is why it was very pleasing to note that this platform has been designed to address some of the psychological implications involved in terms of the COVID pandemic context and the lockdown implications as well for children, but integrating it within the context of how does this then impact on children returning to school and readjusting within the context that they find themselves in, now that relationships between teachers are going to be governed and based largely upon realignment of the models that have been otherwise familiar prior to the COVID pandemic. So, as Dr. Manjra says, most of us in private practice have experienced and seen firsthand that those individuals who have had pre-existing conditions, and in my case, pre-existing psychological conditions, or when dealing with children, pre-existing developmental conditions, the pandemic and the lockdown context has certainly created an amplification of these difficulties. So children who were perhaps presenting with autistic issues in the past, or presenting with developmental challenges, or presenting with underlying emotional difficulties or behavioral problems or pre-existing anxiety, have certainly taken a huge, or borne a huge, lost the screen there. Am I still on, Mohammed?
Yes, you can continue. We'll adjust that. You carry on, Farheen.
Okay. So children that, as I was saying, children that have had pre-existing or underlying emotional or psychological conditions have really borne the brunt of the pandemic woes. And this is where I think it's very, very important for parents and teachers to just bear in mind the emotional state of the child that you are dealing with. Now, in children returning to school, teachers particularly will need to be sensitive with regards to this. What emotional state is the child that you are dealing with in? What type of background has the child come from? What has been the effects of the lockdown on the child? Remember that lockdown has had varying effects on different families. Some families have experienced bonding, have engaged in creative outlets with each other. Other families have taken huge strain. There have been practical realities to deal with, financial, social realities that perhaps might be more grim in some families than in others. And children are active recipients of what goes on in their environments. So children come back to school with all of this amidst the readjustments and realignments that need to occur in the curriculum and in the attempts by teachers and the like to integrate with the safety protocols. Very important in adjusting is to try to understand the mindset of children. And I think I'd like to spend a little bit of time talking a bit about that, getting into the mind of children and understanding how best to deal with them during this time. The one thing to understand is that children cannot learn while they're stressed. So the less stress, the better. Children need to be given the opportunity to tell their stories. So perhaps start off the first few days by getting the child to talk about what lockdown was about. And I know there were quite a few posts going around that children will be asked to talk about what have they done during lockdown. But important is to not be dismissive of what the child has to say. Children who present with specific emotional issues that are becoming quite palpable within the classroom need to be identified, and this needs to then be brought to the attention of the parents. Though the primary responsibility for addressing the child's emotional well-being remains that of the parents, it's not that of the teacher. Likewise, raising COVID awareness remains the responsibility of the parents and not that of the teachers. The teacher's responsibility is to reinforce concepts regarding COVID safety precautions and the like. The parent's responsibility is to keep their finger on the pulse in terms of how is my child doing? Are there presentations in terms of behavioral issues that are untoward or that are uncharacteristic? Ask your child how was their day, what was significant, what was the best part of the day, what part was not particularly enjoyable, etc., etc. And children, being children at times as well, may react particularly strongly to a child who's symptomatic at school, perhaps a child that's sneezing or coughing and so on. Teachers need to be aware that there's a sensitive approach in terms of how this child is treated, so that the child is not feeling stigmatized, isolated, and excluded. There has to be some kind of protocol put into place in terms of how do you deal with a child now who is symptomatic, not necessarily of COVID, but perhaps just a common cold and maybe presenting with similar types of symptoms. But then because of the extent of awareness that there is about COVID symptoms, other children may then react with greater anxiety. And this can then cause or lead to situations that may cause unnecessary stress and heighten the anxiety and apprehension about the susceptibility of infections. Keeping a sense of connectedness as well between teachers and children is important. Age-appropriate information. Dr. Manjra alluded earlier to the fact that there's been an overload of information, age-inappropriate information being spewed out to children that they shouldn't actually be privy to. I think it's very important for parents to please be selective about the type of information that you are exposing your children to. There's lots of inauthentic information circulating social media. Children are then being exposed to it. Watch your tone, watch the way you speak to kids about the facts surrounding COVID, and make sure, in fact, that they are facts, that these are not just stories and conspiracy theories that have absolutely no basis, because children take things literally. They do not have the emotional and cognitive capacity to process information in the way that adults do. And information is then interpreted in a literal manner. When dealing with a child who is already sensitive or who may have an existing underlying anxiety, it is taken in a literal manner, and thereby the child then acts out as if that is going to be an impending reality. Children are already worried about their parents' safety. I know for a fact, in terms of my younger son, I've got two sons. My younger son is 7 years old, and he's worried about my safety. If I'm going to work, I work within a hospital environment, and I'm regularly reframing that for him and reassuring him in terms of the above. But having said that, as well, it's important to be honest with your kids. It's important to let them know that you share their uncertainty, but that at the end of the day, that you are the adult, you are responsible for their well-being and their safety, and that their protection is your priority, their well-being is your priority. Let them also keep things in perspective. The same applies to being in school. Teach them the concept of resilience. This is an opportunity for cultivating resilience in children as well. The point is not essentially about looking at whether the glass is half full or half empty. Teach them that the glass is refillable. And once we look at that, we also teach children to learn to live with uncertainty, learn to develop the attitude of gratitude, learn to understand the concept of trust in the Almighty, to trust that in living with uncertainty, we also open ourselves to the fact that faith is greater than fear, and that faith is what will get us through, that sharing in this experience, working together, trusting each other, taking responsibility for what we can control, and surrendering to the higher power is what will help us cope during these testing times. Essentially, ultimately, children need to feel safe, they need to feel secure, and they need to know that their well-being remains your priority. Teach them that they can be happy even despite the fact that we are living in uncertain times, that they can grow, that they can develop, despite the fact that there's uncertainty and apprehension around us, and that you are protecting them amidst all of the chaos. That chaos being around us does not take away the fact that we can find stability within ourselves and we can access it within ourselves. Should there be a need for a child to be taken through for treatment of any kind, if you feel that your child's symptoms are not settling and the child is now beginning to externalize in terms of physical symptoms, the child is restless, not eating, not sleeping well, there are lots of somatic presentations, it then becomes a parent's responsibility to refer the child to a psychologist, a clinical psychologist, or a pediatrician, and from there, a treatment protocol will be implemented and put into place. Where there's a problem, there's always a solution, and essentially it's about installation of hope and about progress, and that is always possible.
Thank you very much, Dr. Farheen, for that rather detailed explanation of some of the challenges that children and parents will have during this COVID-19 pandemic. So I think there's a lot to take from whatever you have said, from the emotional and psychological aspects of children dealing with this COVID-19. So shukran for that. Our next speaker is Dr. Aamena Moola. She is a physician whose focus is on holistic and integrative medicine. And she's going to address us for 7 minutes, please, on some of the issues that you would want to advise parents and teachers and even learners if they are listening in or watching this particular webinar. Dr. Aamena, it's up to you.
Assalamu alaikum. Thank you to Dr. Manjra and Dr. Majid for their input. I think Dr. Manjra has put us at ease with regards to the infective rates amongst the children. What I'd like to talk about as a mother who's already had one child going back to school is also the impact that the lockdown has had on us as families and as communities. So we are, as human beings, social beings. We interact via social interaction. We get comfort from touch and words and being in the company of others. We also learn from social interaction. Children also learn from social interaction. They learn by example. They learn to follow instructions better by being in groups. They learn compassion, empathy, cooperation, working with others, and interacting. And we as adults also find support and belonging within our social circles. So in the lockdown, we have lacked this. In spite of having video chats and phone calls that we have easy access to, this is one aspect that has been sorely lacking. Touch can provide such huge healing powers within our society, and social distancing has eliminated this to a large extent. We can still use this touch with our families, but by going back to school, we are able to reintegrate into the social mechanism of interaction, because this contributes a large part to our development as human beings. In terms of health and well-being, we have 4 aspects of the human body to look at. And that's the emotional and the psychological aspects, the physical and the spiritual. Now, in these times, we are hiding from what we perceive to be a physical threat. What has happened to the other aspects of our health? It is very difficult for us as parents to provide all the needs that our children have. Most of us have been in lockdown in small spaces. We have limited access to outdoor space, which means we limit our children's physical development. It's critical in their growth years to have exercise, to build fine motor, gross motor skills, to also build muscles, and to maintain healthy BMIs. Dr. Manjra spoke about high BMIs and the risk of COVID. But in keeping that lack of exercise, which we are all limited in at home, we are increasing their risk of not only COVID, but other diseases as well. So it's important for the kids to get out, and school is one of these one means of them doing that. In addition, we find it difficult at home sometimes to maintain routines for intellectual and spiritual work. School helps to build this discipline in our children. The reality is we can't do all of it at home. We need the school system to assist us with this. And large numbers of us are working. We don't have the time and the energy to divert into this. Children also respond better in groups. When they see their peers doing something, they are more likely to respond. There's also many kids who have been exposed to excessive screen time. This is the reality of what lockdown has done to many of us. While it may have been necessary initially, the detrimental effects of screen time cannot be denied. None of us can say that it's fine to keep kids on screens for long times. A school allows us not to have to resort to these measures excessively. As with adults, children also become frustrated by staying in the same environment all of the time. School offers a change of scenery, which contributes to a less frustrated child. We also might find that the change of environment and caregiver can allow the child to express their fears and insecurities more readily. And these feelings we as adults need to deal with. As Dr. Majid spoke about, we need to be able to speak about these things to our children, but sometimes they aren't able to access all of these feelings with one caregiver, or they might feel threatened in certain environments. So exposing them to a variety of environments may help to loosen that up. Being in an environment with other peers also helps them to see that what they are feeling is not abnormal, that other kids are feeling the same way. We can't keep our children locked up because we perceive a physical threat and allow all of their other needs to be neglected. This would be a disservice to them and in their upbringing. I would also like to add that as a parent who did opt for homeschooling for a period of time, it is not a methodology that is for every child or for every parent. And with me specifically, I found that my kids missed peer interaction and age-appropriate socialization. We can interact with them as parents and we can do the best as we can, but we can't be their peers. We can't be friends to them. We can't give them the interaction that other children the same age can provide for them. So we need to really be aware that school can, in an age appropriate and with adequate social distancing, provide a very necessary service in this time. We cannot keep them locked in because we are scared that they might get a flu-like illness which might last a few days. Yes, it might be worse in some people, but is it worth restricting their development for fear of this? Okay, so that's all I've got to say.
Thank you, Aamena, for those words. I think as a parent and as a physician, I think you've summed up the idea that that we are social beings, and our children miss their colleagues, their friends in school. And I was in school during the week, and I asked all the kids what they felt like, and they said we just wanted to get back to school. So I think that's a very strong message that you have put across, that kids need to interact, kids need to socialize, and for them to go back to school is actually the best. So thank you for that. We now go on to our last speaker, Nasreen Sardiwalla, who's also a psychologist, clinical psychologist in practice, and she's also a parent at Wonderkids. So here we have another professional who has wearing two caps. So over to you, Nasreen.
Okay, Assalamu alaikum. Jazakallah Muhammad, and to Wonderkids for giving me this opportunity. And Jazakallah so much, my previous colleagues who have imparted some really beneficial knowledge to all of us. Okay, so to start off with, I just want to explain a concept that we psychologists always, refer to in terms of mental health. We always say there is no health without mental health. But under these circumstances in this pandemic, I've actually felt that this needed to be changed. Our mental health has actually taken a strain due to a realistic threat on our health. And I think that is something that we cannot take for granted. We cannot negate the seriousness of this pandemic. And therefore, there are some serious concerns in terms of how parents, how learners, and how the public in general have reacted to this, and reasonably so. There is no right or wrong decision. We are making a decision based on each of our own circumstances and perceptions at this point. No parent should have to feel guilted for not sending their kids back to school. But by the same token, no parents should feel guilted for sending their kids to school. And herein lies the answer. We need to ask ourselves the reasons for the decisions we make, based not on media hype, not on what other parents are doing, but informed decisions from our professionals, and hence the webinar that we are having today. On the other hand, this virus is here to stay. So there's also the question, for how long do we keep our kids at home? Yes, as Dr. Moola has just pointed out, she had her kids in homeschooling. Homeschooling has been around for decades and it has worked successfully. So yes, this is an option. But for these families who made the decision to homeschool their children outside the pandemic, this decision was probably made strategically for financial reasons, religious reasons, psychological reasons. I ask you now, are you making this decision under duress? And also, is your environment conducive to homeschooling? So, for example, are both parents working? Is it financially viable to homeschool your child? So the big question, why are we here today? Should my child go back to school? It's not a question for me to answer. It most certainly is one for the parent to answer. But as I mentioned before, it should not be based on media hype, but rather on scientific evidence. So let's talk about that. Let's talk about the effects of this pandemic. For some, they actually might resist going back, and maybe for the following reasons: that normal will never be the same, and adjusting to a new normal may be very anxiety provoking, if there is such a thing even as a new normal. For some, life was probably better in isolation. We were protected adequately. Home created a safety net, no anxieties, no disease. Some families have good socioeconomic standing. Both parents being at home is a positive. Parents who have their kids in proper state schools may be facing fears of larger numbers. This is something I think we also need to take into consideration, that not everyone is going to the same type of schooling, and therefore certain anxieties from certain parents are very much warranted. Anxieties of parents are realistic. Okay, they're worried. How are their children not going to touch other children? What's going to happen on the playground? How will my child know to put on his mask at a certain time? These are realistic. Does my child have comorbid conditions? Dr. Manjra has answered that for us in detail, so I'm not going to go into that further. So things that may actually prod us to send our children to school or wanting us to get back to normal would be life in isolation was actually worse. I think Dr. Farheen A Majid touched on this. You know, you have to look at the home's circumstances. Certain homes may have had instances of gender-based violence, domestic violence, parents who were not present all the time, leaving the children feeling neglected. So children need an escape from this. And normally school provides that safe haven for children away from these aspects. Some parents do not have a choice in the matter. Both are working. There are no extended family to see to the parents. They cannot afford caregivers for children. So there is no choice in this matter for them. I think Dr. Moola spoke about the need for human contact, or it may have been Dr. Farheen Majid. Although this is a secondary need, if we look at our human hierarchy of needs, it's a very much important need, especially for children. If you look at a school like Wonderkids that works on the six senses, you know, all these senses have to be stimulated in the Montessori way of teaching, which shows how important it is to stimulate our children. And that may not necessarily happen at home. Also, the wealthy, people who are more advantaged, they were probably able to compensate lack of social interaction, while the more disadvantaged children are still impacted, both socially, economically, and even nutritionally. And these may be some of the reasons that these kids would want to go back to school. Matriculants, so many matric parents have told me there is no choice. They are sending their kids back to school. Okay, so when we look at impacts, we need to look at normal impacts, how children could have been impacted by this pandemic, and then of course concerning impacts. So although what I'm about to say may seem minimizing, but let me just finish. Some of the normal impacts you may find in children going back to school would be confusion, anger, anxiety, mild depression, insomnia, exhaustion, certain OCD traits, because this whole virus has to do with constant sanitization and washing of hands. Right? These are things we need to expect. That is why I call them normal impacts. Not to say that, you know what, in any way we are minimizing how this makes your child feel. So what then are concerning impacts? Okay, this whole lockdown has been a loss of normality for all of us. So we term that as grief. Grief is not something that you only experience when you lose a loved one. It can be the loss of anything. And as I just explained, in this lockdown, we've lost all normality. So children will experience grief reactions, different stages of grief. We need to look at how severe those are and how they're managing with it. Children will experience complicated impacts could include anxiety disorders, acute stress disorder, traumatic stress disorder as a result to certain experiences in lockdown. For instance, witnessing a loved one infected with the virus, knowing someone who has died from the virus, OCD traits, as I mentioned before, eating disorders, conversion disorders. I think Dr. Manjra spoke a bit to us about that yesterday, that he's seeing so many children with conversion disorders. And like Dr. Farheen Majid said, we also have to look at the previous psychological disposition of children. So we have to see, is this a child who was previously ADHD? Is this a child who was previously diagnosed with major depression? These are concerns then that need to be referred to a psychologist and then evaluated as to whether these kids are actually ready to go back to school. But like I said, just remember the normal impacts are very much similar to these, but not to the same degree. Okay, so I just want to move on, and I think this is the part I want to concentrate on a little bit more. So how to help kids cope, sorry. Let's rather deal with that, because I think that is what, if we can help parents feel more relaxed in how they're able to help their children, it might help them make a decision as to whether children should go back to school or not. So firstly, I would say focus on what we really know rather than the things that we don't. Taking what medical professionals are telling us to get a more realistic outlook instead of media hype. The media has caused havoc, not just only with children, with adults as well. So imagine how the little child mind comprehends this. A parent's own anxieties. In psychology, we have a phenomenon that's called a high EE. High EE means expressed emotion. So, you know, I've so often heard parents openly saying to their children, I will never send you back to school. You will die if you go back to school. And I've seen one on social media recently, rather dig a grave than miss a grade. Is this how we express emotion in front of our kids? what we are actually doing by this is destabilizing our kids. So parents, please watch what you say and what you make your children privy to on social media. Actively listen to your kids, asking them about their thoughts and feelings. And it's okay not to have all the answers. Normalizing their feelings. It's okay, say to them, it's okay to worry about how you'll feel. How will you wear the mask? How will you play with your friends? Whether you will get sick or not. How will you play a simple game like chase? How will you catch your friend when it's time to play chase? Discuss these things with your kids. Also start now. Start reintegrating your kids back into society, whether you plan to send them to school or not. Drives, trips to the supermarket, getting back into a routine at home. We all know our routines have gone haywire. Meal times, bedtime, start putting them into place now. So even if you want to send the kids back in a few months, it becomes easier for them. Focus on what you can control. Social distancing, hygiene, masking, new ways of playing, new ways of interacting. Be interactive with your kids and come up with solutions for these rather than, I don't know how we're going to work this out. Okay, provide reassurance, not necessarily solutions. Say to the child, you can do this. I'm just as afraid as you are, because, hey, we all are afraid. Okay, discuss measures taken by schools. Wonderkids and many other schools have taken measures to make schools safer. I want to say to teachers as well, lower your expectations. Kids have not learned for a while. They cannot just go back to normal schooling. Kids cannot just continue where they left off. You will get poor results. You will get poor concentration. Explore the positives, meeting their friends, meeting their teachers, role model behavior that you want. So if you say to your child, you need to social distance, then you at home need to social distance as well. If you're saying to the child, put on your mask all the time, you need to do the same thing. And remember, nothing is cast in stone. At any point, one can review their decision. And either way, you can choose to take your kids out of school again, or you can choose to re-emerge them. And as a last point of coping, I would just like to say, you know, I think our audience is 90% Muslim-based, but even for that matter, whether it's any religion, use your religion as a faith or anchor. Everything is by the decree of Allah. You know, there's been so much said about tying one's camel. That can be taken in so many connotations. It doesn't necessarily have to be in sending your children to school or not. It can mean as well sending your child to school and taking the right precautions. Ultimately, we can even infect our children on our own. I mean, I'm a frontline worker and I work in hospitals. And I presume there's many out there that are experiencing the same thing as I am. Okay, I know I don't have a lot of time left, but as I promised the organizers, I want to speak a little bit about my personal experience. I have two kids, a 10-year-old and a 6-year-old. And the last 2 months have been challenging, to say the least. I have been working part-time, so it's been difficult juggling. I've suffered a lot of mom guilt. I've had a lack of patience, and I think many moms there can relate to this. The kids are very sensory perceptive. They've picked up on this. And I think, you know, in a way, it's affected my relationship with my children to a certain degree. So I myself want things to get back to normal if that's possible. My son, who is a little older, he actually wants to go back to school. And this is the funny part. I've asked so many parents if their kids want to go back to school, and the answer has always been yes. And this is so odd when every Monday they cannot stand going to school. But why? This is the child's subconscious. The subconscious for structure. Children strive on structure, for routine, for normality, for socializing, for their teachers who they love, for their friends who they want to be with. And then on the other hand, my 6-year-old has legitimate fears. She spoke to her teacher the other day on Microsoft Teams, and she said to her, how will we use the items on the shelf? Where will we keep our bags? Because our bags are not supposed to be on hooks with other children's. And I was amazed at the answers, because it looks like the schools have put things in place to already deal with these type of things. And these are the questions that you actually need to sit with your kids with and brainstorm. So as the last, I'm concluding now, Mr. Amra. As a last point, and this is solely my personal point of view, I feel, as much as fear is realistic in this situation, allowing fear to dictate choice to our children can be detrimental. If we keep our kids, if we show kids our fear, that means we are not showing them that fear can be avoided, that we are showing them that fear must be avoided at all cost. And showing kids that sometimes makes them less courageous and brave in their human interactions and ultimately in their lives. Thank you.
Thank you very much, Nasreen, for that quite an extensive presentation. I think there's lots that we can learn from your advice. And I think people need to go back onto YouTube and listen to the recordings again, because I think that would make, we have to digest this. This is too much in one webinar for an hour, 15 minutes to take everything in. So there's lots of pointers that you have directed parents to think about. And I think the clarion call, as I see from all the presenters, is that we need to send our children back to school because we need some kind of normal. But again, there are reservations on some parents, and there are some questions that we have seen or have received already on the YouTube. Wants to send some questions, please go on to the YouTube channel, and there's a chat there, and you can pose your questions. So we've got a few already for Dr. Manjra. So Dr. Manjra, are you ready? The first question is, how soon can we expect a vaccine in South Africa? The second one is, can infections recur in patients who have already been infected? And the third is, why are we opening the schools during the peak or the expected peak? And why are we taking this risk or this gamble? So, Ahmed.
Let's start with the vaccines. Vaccines are a very complex form of medicines. They require lots of technology. And vaccines and drugs, they have to go through different phases of testing before they're available for the general public. So just to give you an example, any drug or vaccine has to go through 4 different stages. The phase 1 study is where you do it in animal models, where you inject a vaccine and you try and see if you can make antibodies and see if the vaccine works. There's 2 aspects to any vaccine or medicines. It's about safety and efficacy. So you have to make sure that it's working and it's also absolutely safe. Phase 2 is you give it to healthy volunteers. Phase 3 is phase 1 is healthy. Phase 1 is animals. Phase 2 is healthy volunteers, and phase 3 studies are one where you do it in large numbers of populations. Now that of course requires a lot of resources. At this point in time, we are between phase 2 and phase 3. So a vaccine can take any time between 18 months to 24 months of research before it's available on a commercial market. I think that because this pandemic has particularly affected Western countries, North America and Europe in particular, they will find a vaccine. Unlike, say, we don't have a vaccine for TB and malaria or diseases of poor populations. We don't have a vaccine for HIV because it's poor people that are affected. And of course, there isn't much incentive for drug companies to make these vaccines. But because people in rich countries are affected this time, and this is the first time a pandemic of this nature has affected wealthy populations, I am almost certain that they will find a vaccine with time. One of the problems is that, there are 2 types of viruses. You get DNA viruses and RNA viruses, and COVID-19 is an RNA virus. It's much more difficult to make an RNA viral vaccine than to make a DNA viral vaccine. So I predict, from what I've read so far, that hopefully, inshallah, by middle of next year, we should have a vaccine for use by all populations. The drug companies that have been commissioned to manufacture these vaccines have promised to make it available not only to rich countries, but to poor countries as well. The second question relates to whether you can pick up the infection the second time round? Well, that can only be answered when we go to the second wave of infections. We're only going through the first wave of infections at this point in time. There have been some reports from other parts of the world where patients had recovered and they retested positive. But those studies are dubious. And one of the things that, remember, the test is measuring is viral genetic material. They do, PCR studies. And sometimes there may be still a bit of virus around, and they could be measuring it in these patients. So it doesn't necessarily mean that the patient gets, in contact with the virus, you're going to get infected the second time around. So that answer will only have a firm answer for that kind of question, whether we can get reinfection, is when we see the second wave of infections, and whether people that were infected during the first wave also got infected in the second wave. Remember, with the Spanish flu, more people died with the second wave of infection than the first wave of infection. And that's because the virus mutates. And when it mutates, obviously, whatever immunity you had from your first infection is not effective against the mutated virus. The third question is, why are we opening schools during a critical phase of our pandemic where the numbers are increasing significantly? Well, remember the lockdown measures that the government implemented, not only in this country, but all governments of the world, does not prevent infection. All it does is delay infections. It flattens the curve. So the same number of people will pick up infections, but they will pick it up over many months, maybe 4 to 6 months. Compared to if we didn't have the lockdown, then there would have been a peak of infections over a short period of time, and the health systems and the health facilities would have been overwhelmed. So all that the lockdown level 5 have achieved for us is a slowing of the curve, lesser infections, but the infections will occur over a longer period of time, which gives us time to prepare and also to learn more about this virus. So the numbers will go up. The expected peak of the infection is going to be around July, August, September. You can't keep schools closed for that period of time. Then you might as well not open for the rest of the year. You've lost the entire school year. Like I've mentioned in my presentation, the risk of infection in young populations is very small. And therefore, we believe as a pediatric community that it is safe to open schools, even though the numbers are increasing. Even in South Africa, the number of children infected is very small. I only know of one child that has died in South Africa. It was a premature baby whose mother was infected and the baby was infected. Whether the death was COVID, directly related to COVID infection or was caused by prematurity, we don't know. Often people will die from some other disease but are infected by COVID, so it's a COVID-related death, but not caused directly by the viral infection. So once again, I think despite the numbers going up at this point in time, and the numbers are increasing by over 1,000 every day, I think it's still safe. You will find that there will be clusters of infections in schools, and those schools will have to close down, for temporary periods of time to allow for sanitation and to allow for reduction of the spread of the virus. That will happen, and one must expect that to happen. And that doesn't necessarily mean that it's not safe to open schools. Another question that somebody had asked is, can teachers pass the virus on to children? Yes. So teachers can pass the virus on to children if they're infected, but usually it's not the other way around, where children are unlikely to pass the virus on to teachers.
Thank you, Ahmed, for addressing those questions quite informatively. The next question is for Farheen, Dr. Farheen. The question is, can child psychologists discuss the effects of precautionary measures, that is what is taken in social distancing, in masking, etc. Would that create creates a cold, unsocial environment at school, especially for toddlers and playgroups? So what is your view on the effect of these measures? Dr. Farheen, you can come on.
Okay, I'm on now. Given the fact that we have been in lockdown for an extended period and we have been observing the safety protocol measures already within our homes and, when otherwise out of our homes. It's not an unfamiliar situation for any of us, including toddlers, including very young children. So children have already been exposed to these precautionary measures. But I do understand where the question is coming from, in that I think the person's concerned that it's going to, in some way, dilute the intention of the school being an environment of play and learning for children, and create some kind of tension that is going to probably heighten a child's existing anxiety when they come in. What's very, very important to note is that learning cannot take place, like I said earlier, within a context of fear. So the manner in which a child is being taught to, or the manner in which these concepts are reinforced to children regarding precautionary measures, that is quite important to bear in mind. Age appropriate modes of education is important. So teachers who are now implementing precautionary measures in terms of the social distancing rules, masks, sanitizing, need to convey this in a manner that the child can firstly understand, language that is understandable. Visual tools are quite important as well. So using drawings for very young children, having pictures and drawings put up on walls so that it's there for the child to visually refer to. And of course, during class lessons or during orientation, to perhaps impart this message through age-appropriate techniques, where with toddlers, with very young children, you might want to use puppet play, you might want to impart techniques of role playing, you might want to get older children enacting scenes where they are, putting on a mask, etc., etc. So there's a concept of fun also being incorporated, because you don't want children to lose the concept of fun and be teaching these skills and educating them and raising awareness within a context of fear, and thereby reinforcing anxieties. So while we want to keep away from creating hostility, creating coldness, reinforcing anxiety, parents are also concerned that these precautionary measures have to be implemented. In order for them to be implemented, it must be done so in an age-appropriate manner, in a calm manner, addressing kids' concerns as they do come up, and doing so in a manner that also incorporates fun during the learning process.
Thank you, Dr. Farheen. Thank you, Farheen, for that. I think that's quite a lot. We have a flood of questions, so I'm going to ask all the respondents, please to keep it short and brief, because we have a lot of questions to go through. The next one is for Dr. Aamena Moola. Next two questions. First is some natural immune tips for children, if you want to offer that. And of course, things like what vitamins can you give a child to boost the immune system, especially for the very young, like a baby under 1 year old. Aamena.
Okay, so I just quickly want to say something about the last question. Is that was one of my concerns with my children going back, was how the masks would affect them and how the social distancing would. And although I have a 12-year-old, children are remarkably adaptable. And the fact that schools are changing their hours, shortening their days, and allowing for smaller classrooms allows the integration to be a little bit better. And they adapt pretty well to this masking and unmasking situation, as well as the visors. Coming on to immune boosting, I think it's important for all of us, regardless of the COVID situation, to take into account vitamin D levels. Low vitamin D levels predispose one to more viral infections. Vitamin C levels, so supplementation if necessary with vitamin D and vitamin C. We also need to be aware of the food that we feed our children. We need to avoid the sugary foods, processed foods, and look for more nutrient-based whole foods, vegetables, fruit, with bits of meat, healthy fats. And in feeding them good nutrition, we are providing the nutrients for good health, and allowing the immune systems to be able to adequately resist more infections That said, infections build immune systems as well. So in completely sterilizing our environments, we're not doing our children any favors. Children are meant to get mild illnesses, and this builds the immune system in the long run. So we shouldn't be completely scared and freak out every time our child has a cough or a cold. This is part of the growing process and allows immune systems to build up. I hope that answers the question.
Thanks, Aamena. Yes, that's really good. I think you've done it well. Ahmed, for you, next two questions about children. Parents are worried that the child is worried actually about eating her lunch at school. Are there any guidelines for that? And would children be safe wearing just a face shield as opposed to a mask?
Okay, so I've just been corrected by one of your listeners that there's been at least 5 deaths in South Africa. I was only aware of 1. So it seems as though, there have been more deaths which I was unaware of. So 5 deaths of children. So that's just a correction. I wasn't aware of that. I was only aware of 1 death. So there's probably, an update on that. As far as, so you said masks versus visors. Is that the question, Mohammed? Yeah, I think there are no studies as such comparing masks versus visors. Certainly in high-risk situations like we are in theater and so on, we wear both masks and visors. Children don't tolerate masks very well. Most adults don't tolerate masks very well. Most people wear their mask on their chin. It doesn't cover their nose and their mouth. They're basically wasting their time. I mean, you can't transmit the virus from your chin. And if you see people walking around and running and driving, the mask mainly sits on the chin. It's supposed to cover your nose and your mouth because these are the areas of transmission of the virus. So children that cannot tolerate the mask can wear a visor, and that's the advisory that we give because not all children will tolerate a mask. As far as which is more effective, we don't know. There are no studies comparing mask versus visors. You must remember that the cloth masks do not prevent you from picking up an infection. It prevents you from transmitting your virus onto somebody else. It doesn't have any protective properties. Unlike the medical N95 mask that we wear in hospital, these are well-sealed masks which are made with particular fabric which prevent us from picking up infection. The usual cloth masks that are manufactured and have flooded the market now only prevent you from transmitting your virus. So it's for protection of other people, not necessarily yourself.
There's one more, Ahmed, for you, same while we're at it. Can you please advise on how children should interact with their grandparents? In other words, if they're elderly at home, what are the rules about that?
Yeah, that's a very difficult question. And, a question that I get asked all the time, that what if my child goes to school, carries the virus and passes it on to grandparents? Like I've mentioned in my talk, the most vulnerable population are the over 60 with comorbidities. So I would suggest that that children that go to school should have minimum contact for the time being with elderly grandparents who have comorbidities, who have hypertension, diabetes, heart disease, or any chronic diseases of a significant nature, which will make them vulnerable to the virus and cause complications. So for the time being, that's what I would advise. Now that can be very difficult for people because a lot of people live in extended families. And the experience in the United Kingdom was the mortality was disproportionately high in the Muslim population because they live in smaller homes, crowded homes, and usually there's 2 or 3 generations of people living within one home. And the virus was transmitted rapidly from one generation to the other. So I would say that if the child has grandparents who have any of these comorbidities, who are more than 60, 65 years of age, there should be minimizing of contact between the child and the grandparents, but this may not always be possible.
Nasreen, there's a question for you. My child is worried about eating her lunch at school. Are there any guidelines for that, Nasreen?
Okay. Firstly, I'd just like to share what I've seen on school websites in their preparation for returning to school. Most have demarcated areas on the play field. They have these little circles or squares. I know I've seen it on the Wonderkids page especially, where where they are about a meter or meter and a half apart. So essentially, your child will not have to wear a face mask without eating. I think having said that, none of us can really wear a face mask while eating. It's very cumbersome. But schools have made preparation for this, even the senior primary school where my son attends. But to make life a little bit easier, maybe you can start role playing this at home. You know, get the child to sit at the eating table with the mask and then show the child how to drop the mask to one ear and then have their meal. So, and this applies to so many other areas where you can actually start role playing these scenarios in your home to make it easier for the child to integrate in school without it being an anxiety to the child. Thank you.
Okay, I'm not sure how much longer to go, but I thought in the next few minutes, we'll just take a few more questions.
Mr. Amra, did you get that answer? Now what? The sound is gone.
Is it okay now? Can you hear me? Sorry about that.
Yeah.
Yeah. Yeah, no, I got that. Thank you very much for that. I'm just saying that we are 96 minutes into the session, the webinar, and that's quite long already. So we don't want to prolong any longer. We'll get a few more minutes. We'll just take a few more questions and then try and conclude. The next question is there a negative effect on vision or visual perception when using protective visors for a long period of time? In other words, the film that the visor is made of. I'm not sure if there's anybody there that wants to do it, tackle that question. It's not specific to any specialty, but general. Anybody? Aamena, whether you want to do that?
I don't know. I have no idea.
Okay. So I haven't heard of any visual problems with visors specifically, but I have said that I have seen that with my daughter who wears glasses in the classroom, that the visor has been a beneficial addition because but then again, she's had to go through 2 different types of visors before we found one that does work and doesn't obscure the vision, because wearing a mask with glasses does cause the mask to fog up. So she's then used the visor instead to compensate for the slight lowering of the mask and being able to see the board in that time. So there are, you have to be adaptable in this and look at different methodologies with the children to find what works for them. I'm not sure specifically whether the visor affects vision.
Yeah, no, I think there has been some discussion and there's no clarity of one over the other. I think it's just like Dr. Manjra said, there's no evidence.
I think it will have to be individualized. So there are some children that will be able to tolerate the masks, and there are some children that won't be able to tolerate the mask, who will then benefit from the visor.
Okay.
You know, I think it have to be done on an individual basis. But there are no studies comparing visors with masks, but there are studies comparing different types of masks. So, you know, the N95 mask, the K95 mask, the cloth mask, there have been studies looking at that, but that's an entirely different topic.
Okay, Ahmed, another question for you. Would you advise keeping an older sibling, about 7 years old, at home if there's a younger sibling who's at risk because that child has CP, with generalized muscle weakness, epilepsy, and a weak cough? So would you advise that child who's older to stay at home or to go to school?
No, I would advise the child to go to school for 2 reasons. One is that the chances of the child picking up the infection is very, very low, like I mentioned from my talk. And secondly, the chances of the child transmitting the infection to the sibling at home with cerebral palsy is also very, very low. So because the risks are low, the benefit will far outweigh the risks of picking up the virus and transmitting it. Therefore, I would recommend that the child should go to school.
Okay, thank you, Ahmed. I think we're going to close this session because it's already been 1 hour, almost 1 hour, 40 minutes. So what I want to do is that if each participant in about 2 minutes, just sort of round up final comments. And I think we also need to make a disclaimer that we're not in any way particularly promoting one or two particular options, but it's very much based on what parents feel, what they've learned from this particular webinar. And I'm hoping that they will be more informed when they're making a decision whether to send their children back to school when it opens on Monday. Some schools, private schools, have already opened, and others are opening on Monday. So it's really the parents' decision. So maybe, Ahmed, while you're still on, your mic is on. If you want to just round up and give us a short sort of summary of what parents should be looking at.
So those who may have missed my talk, just a short summary is that few children are infected. When they do get infected, they pick up mild symptoms. The complication rate in children is very, very small. The mortality rate in children is very, very small. Therefore, it's safe for children under 19 years of age to either attend school or to attend universities, because the mortality rate has been very, very small and the complication rate has been small. So that's the knowledge we have at this point in time. It may change with time since the knowledge on COVID-19 is evolving. And this is what we know at this point in time.
Again, just agreeing with what Dr. Manjra says is that there are no clear-cut answers. There's a plethora of information that we have with us. We have to be able to sieve out what's relevant versus what's not and make informed decisions from there on. Look at the psychological and emotional aspects of a child's well-being, apart from the physical safety precautions that need to be taken, and do the best that we can as parents, as teachers, and as a team, and prioritize both physical and emotional safety and well-being, reach out where we need to, and trust that the process is a work in progress. And where we need to make certain decisions that work in the best interest of the child and that may not necessarily be in keeping with the majority, then so be it. But whatever it may be, to exercise leniency and flexibility where required, and be flexible as well where required.
Thank you, Dr. Farheen. Aamena, you want to say the parting words?
While we all have to take precautions, let's try and move away from a fear-based world. Let's try and encourage compassion, empathy, mercy amongst all of us, so that we may come out of this a better individuals and a better people.
Thank you. Thank you, Aamena. And lastly, Nasreen.
Okay, like Mr. Amra has said, in no way we are advocating that kids should or should not go to school. Look at each of your own circumstances in its own way. Assess the psychological state of your child at present, and then make an informed decision. And put some of the coping strategies that we have discussed today in place, whether you're sending your child to school now or at a later stage. And just to add on where I left off at the end, and like Dr. Moola has just said, it is a heightened situation, but let us not only be controlled by fear. There are so many other strong, positive human emotions that we have. Let us try to focus on these after this webinar today, and then make your decision. Thank you.
Thank you very much to all of you and to the panelists, Dr. Ahmed Manjra, Farheen Majid, Aamena Moola, and Nasreen Ebrahim Sardiwalla, for your inputs. I think this has been a really good webinar where we've touched on some of the sore points, if I may say, where people are concerned, their fears, there's paranoia, there's mixed messages, there's so much of social media outpourings on why we're going, why we're not going, why are we taking this risk, and so on. Keep the schools closed. But I think every parent has to evaluate their own circumstances. There are working parents who don't have any support structures at home, no extended families. Others have a situation where the conditions have a lot of elderly parents, people at home, grandparents, uncles, aunts, and so on. So everybody has a different context. And I think you have to make that decision. But I think one of the most important points that come out from this particular webinar is that the fear that has been driven should be allayed, and I think people should feel more comfortable that if they do send their children back to school, it will not be a wrong decision from the science that Dr. Ahmed Manjra has presented. So on that note, I want to apologize that there's been lots of other questions, but I don't think we can really deal with those questions now. I think we've exhausted our time, and I don't think we can. Our attention span also has been tested in this particular. So once again, on behalf of the Wonderkids Montessori Pre and Primary School and all the panelists here, to thank all the listeners and the viewers. And I hope that you will go back to the YouTube channels of Wonderkids and see and listen again once more and spread the word so at least people are more informed when they do make a decision, probably this weekend, because school starts on Monday morning, 8th of June. So stay safe, stay healthy, keep with the safety and healthy precautions of masking, social distancing, washing, sanitizing. And I'm sure I've seen a lot of the videos from different schools, and every school that we have seen the videos of, they're all taking the precautions. So rest assured, I think the schools are responsible and they will take care of your children's welfare in terms of the COVID-19 safety precautions. With that, I say thank you, shukran, assalamu alaikum, and good evening, Sawbona, and take care.